Physician assistants are healthcare providers that work with a team of nurses and physicians to help to treat patients. I like the variety a PA has. For instance, I work in dermatology, but if I needed to moonlight in an urgent care setting or an ER, I can do that. What I also like about my job is the hours, at least in my particular field, are pretty decent. My days are usually about 7:30 to 5:30 whenever I get done with paperwork and patient phone calls. What I don't like about the profession is just the amount of education I think the public has about PAs. And it's to no fault of their own, but some people will say, so are you a doctor or are you not? Or they'll confuse us with like medical assistants. The way a PA relates to the rest of the healthcare team is we're considered mid-level providers. So a PA works under the license of a physician. A lot of things a PA can see by themselves. We can prescribe medications, we can perform procedures. As long as it's something that your supervising physician is comfortable with you doing and has trained you to do it in a proficient manner, then that's all that's really required. PA school is typically 2 years. The first full year, at least for my program, was all didactic work. So it's all book work. You're sitting in a classroom from 8 to 5, sometimes a little bit later. The second year is mostly clinical work. So, for instance, my program, a month at a time, we would rotate in different clinical settings. 1 month we would do a pediatric clinic. The next month would be internal medicine. The month after that would be ER. As far as scholastic preparedness, your GPA needs to be competitive. The more people that apply to programs, the more competitive it's going to get. That being said, just because you have a 4.0 GPA does not guarantee you a slot in any PA program. They're going to look to see how well-rounded you are as an individual. As far as compensation goes for physician assistants, it does vary from state to state, and it does vary from specialty to specialty. The PA will typically earn, coming out of school, anywhere from maybe $65,000 a year all the way up to PA with experience in a highly sought-after subspecialty up to maybe 125, 150, maybe even 175. The more knowledge you have, the more experience you have, your salary goes up from there.